Whether you're one of the over 65 million Americans that are on Medicare, or if you're 5, 10, or 20 years away, there's some new Medicare rules that we all need to know about because they're either going to impact us now or in the future. So in today's video, I want to share with you 7 changes that are happening to Medicare in 2025. We're going to dive into this article by AARP called 7 Medicare Changes You're Seeing in 2025. But before we do, I want to thank this video's sponsor, it's Chapter, and they are a free Medicare advisor that helps you navigate the complexities that we're going to see is associated with Medicare. So thank you, Chapter. Okay, let's jump into this article. I've got good news for you. The subheading on it is expensive medications. You'll save thousands. Dementia or mental health care, more options. Okay, so let's go into what this is. The first one is there's a $2,000 out-of-pocket spending cap for prescriptions. And that is for a prescription medication and applies to standalone Medicare Part D policies and drug coverage in the Medicare Advantage plans. And it's the first time in history of the Medicare program that people have a cap on how much they could pay out of pocket. That's according to Meena Sashami, who's a physician and now the director of the Federal Center for Medicare. She said in an interview to AARP in 2024. The second one is no more donut hole. 2025 Part D plans can have a deductible of up to $590. After that, you have co-payments on your medication until your out-of-pocket reach that earlier mentioned $2,000 cap. And the cap is expected to help millions of Americans. An estimated 3.2 million people in Medicare drug plans will save money on their covered medication, according to a recent report by the AARP. So that's good news. Many people are interested in weight loss. We've got an update on weight loss drugs as well. Before we go there, I do want to tell you about this video sponsor. It's Chapter. I'm proud to partner with Chapter on this. First off, it's a Medicare video, but also because they have done a lot of work to make sure that the data that they have, so when they're letting you know which prescriptions are covered on which plans, or they're letting you know the differences between different alternatives, they have spent a lot of time making sure that their data is correct. The CEO, the founder, the initial team are really experts in data, and they've done a deep dive in making sure the base data is correct. So the information they get you is hopefully dead on with your experience in the real world. The second thing is from a cultural standpoint, from a structural standpoint, they have set up their teams where there are as indifferent as possible between the various plans, and they're committed to helping the individual. They're committed to being an advocate for you and I versus being an advocate for the insurance company. So again, I'm proud to be sponsored by Chapter. You can reach them at the phone number here, at the QR code down here, or in the linked or the pinned comment below. Thank you again, Chapter. Okay, let's talk more about this weight loss drug. According to the AARP article, Medicare is prohibited from covering drugs prescribed specifically for weight loss, but Part D plans can cover popular weight loss drugs when they're ordered for other purposes, such as Ozempic and Mounjaro for type 2 diabetes. And elsewhere in the article, I believe there was also something when the overweight is also causing a cardiovascular issue. So look up the article, do some research. I want to put this stuff on your radar screen. I am not a Medicare license advisor. I just want to share this article with you and put some of this news on your radar screen. Okay, item number 4 is subtle changes to your Medicare Advantage coverage. So there's going to be some changes there. Number 5 is a big one. Number 5 is mid-year statements from your Medicare Advantage plan. If you're on a Medicare Advantage plan, there's all of these supplemental benefits like maybe a dental or a vision plan. And so now once a year in the middle of the year in July, by law, the Medicare Advantage plan is required to send its people, its enrollees, a letter saying, hey, these are the benefits that you're entitled to. Here's what your out-of-pocket would be if you took advantage of it, and here's how to find out more. Here's how to schedule an appointment, things like that. So I think a lot of people are really gonna benefit from that. Okay, number 5, and stick around because after we get through these 7, there's one big change that was not in this article that I want you to know about. So number 6 is expanded program for family caregiver services. And many of us find ourselves in what we call jokingly, somewhat jokingly call the sandwich generation, right? We have adult children that we're still helping to launch and thrive in life. And then many of us have aging parents, and we're kind of the baloney in between. We've got aging parents that we also want to help out. And so if you're in that situation, there is an expanded program for family caregiver services, a program for dementia patients and their caregivers that launched last year and will quadruple in 2025, serving more of the country. The program's called Guiding an Improved Dementia Experience. So the acronym is GUIDE, and that provides 24/7 support line, a care navigator to help find medical services, and community-based assistance, caregiver training, and up to $2,500 a year for at-home, overnight, or adult care respite services. Patients and their caregivers typically will not have a copayment with that. Okay, the number 7 one on the AARP site, but there's one big one that they didn't cover that I want to cover, so stick with me. And that is a push to add more mental health providers to Medicare. It's estimated that about 20% of seniors report suffering from mental health challenges. And before 2024, licensed marriage and family therapists, mental health counselors, and addiction counselors could not bill Medicare because they weren't allowed to enroll as Medicare providers. And now, fortunately, they can, and many of those people are doing so. Okay, so what's the one item that I think is important for you to know about? This comes from Fortune magazine, and that is their article talks about 3 big changes, but the one I want to highlight is a crackdown on agents and broker who sell 3 types of Medicare plans. And they say currently salespeople sometimes get incentives like exotic vacations and hefty bonuses when they enroll Medicare beneficiaries into private insurance like Medicare Advantage plans. And a new clampdown in the CMS's 1,327-page final rule for Medicare states that it aims to ensure that agents and broker compensation reflect only the legitimate activities required by agents and brokers. And in addition, the rule says that Medicare middlemen, such as third-party marketing organizations, will not be able to offer incentives that inhibit an agent or broker's ability to objectively access and recommend the plans that's best suited to a potential enrollee's needs. This won't really address the issue of pushing people to Medicare Advantage, but according to David Lipschutz, who is the Associate Director for Center of Medicare Advocacy. But what he thinks it will do is limit or restrict people from being steered towards one particular plan because that agent or broker is trying to get a particular bonus or incentive. As I said earlier, I'm proud to be partnered with Chapter on this. They seem to have done a great job of trying to eliminate as many of those biases as possible and focus on being an advocate for you. I hope you enjoyed this video. Making good decisions is really important. And YouTube algorithm says this is the next one of my videos about making good decisions that you should consider watching if you enjoyed this one. Thanks for watching this one. Bye-bye.